Kristen, thank you so much for joining me today. I really am looking forward to our conversation.
Oh, thank you for having me on the show today here, Lakelyn. I really appreciate you giving me the chance to talk with you about Medicare.
Yes, and Medicare, gosh, that is such an overwhelming word for many people. I know many family caregivers that I've interacted with, many older adults. They hear the word Medicare and everyone just kind of feels a little heavier. It can be very overwhelming trying to figure it all out. And so recently you and I have had the chance to talk, and I thought the way you described it was just so simple and wonderful. So I was like, I need to get Kristen on Caregiver Chats so we can talk more about this. And hopefully the family caregivers and people listening today will walk away with a little just better understanding about what Medicare is.
Yeah, and Medicare can definitely be extremely overwhelming, to individuals. And then there's just a lot of confusion. And, you've been guided for your health insurance all through your working years, your whole life by, your HR department, anybody within, your back office within your company. And they kind of just help you along with determining what your health coverage is. And now it kind of falls on your lap and you're like, now what do I do? So there's a lot to it, but really once you get the hang of it and you get the terminology down, the different parts of Medicare, it really then makes a little bit more sense. So
yeah, gosh, that is a good point. Having the HR department, kind of help you through that process. And if you're retired or no longer working, you might not have that. So I think hopefully this conversation will be so helpful. And so I think we should probably just get into it. I know that there's Medicare Part A and B. So maybe let's start there and then we can kind of build upon that and what people need to know.
Yep. So Medicare Part A and Part B, they were originated back in 1965. So they are the two main parts of original Medicare. Now, most individuals do have Medicare Part A premium free because they've paid into that FICA tax all those working years. They need to at least have worked for the 40 quarters and paid into a FICA tax for the 40 quarters in order to get Medicare Part A premium free.
And premium free, sorry to interrupt you, Kristen, but that means you don't pay anything. You get that benefit. Is that correct?
You don't pay a premium.
Premium. Okay. That's probably an important terminology that you mentioned earlier, understanding all the terms. Okay. I'll let you keep going.
Exactly. And so, and I, there is a slide here. Let me see if I can flip through it. So as it's mentioned here, so Medicare Part A is usually premium free. If you or your spouse have worked those 40 quarters in your lifetime, paid into your FICA tax, which comes automatically out of your paycheck, essentially paying into Medicare, then you would have Part A premium free. What does Part A cover? It really covers the hospital insurance, any type of skilled nursing, home health, and then some hospice as well. Okay. So, however, there are some out-of-pocket expenses when you have Part A of Medicare. So, and this changes each year. And I just wanted to show this because there is a lot of confusion out there that I've worked all of my life. I've paid into this program. I've paid into Social Security. And now, I should have health care coverage provided from Medicare, and I don't have to pay anything. Well, actually, there are some out-of-pocket expenses that are involved when you look at the Part A of Medicare. So and these do change each year. Now, if you happen to be hospitalized in 2024 and you have Medicare Part A, then you would pay a deductible, right, when you're admitted into the hospital. So, and that deductible lasts for a 60-day time period. So you are in the hospital in January, you go home, you recover, and then for whatever reason you have another episode, you're back in the hospital in May, you would have to pay that deductible again.
I see. Okay, so there's that 60-day window.
Mm-hmm. Yep. And then there's also some out-of-pocket expenses as it's shown here for if you're still in the hospital after that 60th day and beyond.
Okay.
Yeah.
Well, and you mentioned shown here. So I just want, if you're listening only, we'll share the link to this video on the show notes so that you can see Kristen's helpful slides as well. Because I think sometimes with complex conversations like this, Kristen, it is so nice to have a visual. So would encourage you to check out the video as well. And just to have the visual to go along with what we're talking about today.
Yeah, and I'm a visual learner. That's
Me too.
I like to have things laid out and displayed for me. So another piece I want to talk about too for the Part A of Medicare is that Medicare does cover the first 20 days of skilled nursing.
Okay.
But then after that, if you're still in a skilled nursing facility, still receiving care, then you start having to pay a copay for that as well for day 21 to 100.
Okay.
So
these are all really helpful things to know, especially, many caregivers, their loved ones are hospitalized and return home. Maybe they come home with like a home health care, or maybe they go to a rehab or skilled nursing kind of facility. So very helpful to kind of just understand just what will and will not be covered or what the copays could potentially be. So very, very helpful here.
And also, Medicare does require a 3-night stay in a hospital in order for them to pay the skilled nursing benefit.
That is key because sometimes the individual is in under observation. I have quotation marks when I say that word, observation, which doesn't mean they're admitted. So that's an important thing as a caregiver or care partner to understand, was my loved one hospitalized or were they there under observation? Would you say that's an important distinction, Kristen?
Yes, extremely. And as a caregiver, you can always ask when that person is in the hospital, are they in for observation? How is this being coded right now, their hospital stay? So it's also key. They may want to say after 2 midnights, then they say, well, they can go home. And that they're going to be needing to go to the skilled nursing facility. And so you can be their advocate and say, I honestly think, they need to stay one more night because of Medicare will cover. And that satisfies that 3 midnights stay for Medicare to then pay the skilled nursing.
Ooh, that's also a key point. The 3 midnights. So it has to be, overnight. Okay. That is a very helpful tip. When your loved one is potentially hospitalized.
Right.
So is anything else about Part A that you think is important for people to understand?
Also just, when someone is enrolling into Medicare, another key factor. So when you're turning 65, it's always wise, maybe 6 months prior to your 65th birthday, you start looking to see, planning out what your strategy is. Are you going to get on Medicare? When are you going to start receiving your Social Security benefits? So if you're going to start receiving your Social Security benefits right prior to turning 65 or just the month of your 65th birthday, you will then start on Medicare automatically.
Interesting.
On the Part A of Medicare. So
the Part A. Okay. So it sounds like the Social Security benefit is tied to the Part A benefit of Medicare. Is that correct?
Yep. And Part B too. If you're getting Social Security benefits, then it will tie both Part A and Part B. You'll get that set up automatically. Part B works a little bit different, and we can go through that too. But if you would choose not to take out your Social Security benefits at the time, maybe 62 or 65 or, prior to getting onto Medicare, you will have to physically enroll. You'll need to go out to the Social Security's website or go to their office or do a phone appointment with them and actually enroll into Medicare.
Okay. So you could delay your Social Security potentially, but still get on to Medicare for your health insurance.
Exactly.
Okay.
Yeah.
Also very helpful to know because I know sometimes you hear people are encouraged to delay the Social Security benefit for a variety of reasons. Don't have time to get into it on this episode, maybe another one. But it's good to know that you can still get the Medicare benefit.
Yeah, and we could probably spend a couple hours talking about all of this fun stuff with Medicare. So there is some different moving parts, and each situation is a little bit different. So
Very true.
That individual is going through. So then looking at the Part B of Medicare, So that's that outpatient. So any type of doctor visits, you're going to see a radiologist, any type of outpatient surgeries, ambulance, air or ground. That's where Part B of Medicare, that they cover those types of services. So unlike Medicare Part A, there is a monthly premium for Part B.
Okay.
So
Monthly premium for Part B.
mhm.
That is good to know.
Yep. So, and then I'll just show that here. So typically, on average, the individual's Part B premium is $174.70, and again, that's as of 2024. So that figure can go up or down or stay the same, and it's based on your income. So you want to check to see how you, or if you're still married, or how you filed individually or joint, will determine how much you would pay for your Part B premium.
Okay. So that seems like it's Part B's premium is kind of on a sliding scale based on your income.
Right.
Okay. That's good to know.
Yep. And another key factor with determining what your Part B premium is, it's based on how you filed in 2022. So it's always a 2-year look back.
Oh, interesting. A 2-year look back
Right.
for your premium. Okay.
Right.
That is probably, helpful to know, especially if a person's, situation has changed. Maybe they've had a loved one pass, their partner, their spouse. So, okay, that is very, very helpful.
Yep. So, and then there's other factors that we can look into and talk about if they are still planning to work. If you're working with individuals that are turning 65 and they are still working, you may want to look at this chart and say, how much is my health insurance through my employer today? Or should I get on the Part B of Medicare? And you want to see what the premium differential is there versus, the health insurance through the employer or the Part B premium. So you want to take into consider both of those. If you choose to stay on an employer plan and not pick up the Part B of Medicare at the time in which you get Part A of Medicare, you can defer the Part B of Medicare until a later date.
Okay, great to know. So you don't have to go on it if you want to keep your own health insurance plan. You can kind of do a comparison and see maybe what's going to serve you best.
Right.
Stick with my health insurance through my employer, or do I start with this Medicare Part B? Very helpful information to know.
Yeah. So, and then there's also, outside of the Part B premium, there are some out-of-pocket expenses for Part B. So there's always an annual deductible. So if you go to the doctor, then you would need to satisfy the annual deductible. And then after the annual deductible has been paid, then you would pay 20% of the Medicare approved expense. So Medicare covers 80 and then you cover 20.
All right. So that is also helpful to know, especially if families are planning from a financial perspective, kind of build those figures into their budget. That $240 deductible, and then 20% of the services going forward. So very helpful to know. But I think this is where Medicare Part C might come in. Is that right?
Yep. So
why can't they make this a little more easy to follow? I don't know, but here we are. Okay, we covered Medicare A and B. Now this transitions us into Part C.
Well, and actually so Medicare started in 1965. Medicare supplement plans started in 1966.
Okay.
And what Medicare supplement plans do is they fill in the gaps of original Medicare. So this is, of course, if you have Part A and Part B of Medicare, that's fine. But you're just going to have some out-of-pocket expenses that you need to be aware of. Or you could have Part A and Part B of Medicare, and then you can have a Medicare supplement plan that, again, will fill in the majority, if not all, of the expenses that you may incur. So, so there was parts of Medicare, and now Medicare supplement plans have plans. So, you may see, well, what's Plan A and Plan B and D and G? So those are the various different plans that an insurance carrier may offer in a given state. Most popular plan is a Plan G. So you would have parts A and B of Medicare, and then you would apply for and have a Medicare Supplement Plan G. So
it's like alphabet soup over here.
Yep. Definitely. So, and then if you have a Plan G, it covers all of the out-of-pocket expenses that we went through of Medicare. The only thing it does not cover is that Part B deductible. So that would be, and then you would have a monthly premium for a Medicare supplement plan. So that's what first came about, in the 60s, was the Medicare supplement plans to help seniors pay for those out-of-pocket expenses that were not covered with original Medicare.
So it's kind of like filling in the gap.
Right.
At one point, was it called Medigap insurance?
Some people still call it, and like on the screen, it does say Medigap insurance or Medicare supplements, but yes. So,
okay.
You'll see it referenced, which makes it even more confusing. They reference all of it. So is it a Medicare supplement? Is it a Medigap? Which one is it?
And I think that you also made an important point that I wanted to just call out. Do the Medicare supplement plans vary by state? You had mentioned, something about your state. So is that important for people to know that you really need to learn? If you live in California and your loved one's in Idaho, we need to look into what plans are available in Idaho because it's where my loved one lives. Is that important?
Actually, that's a great point and a great question. Thank goodness they did do this right, but the plans are standardized. So,
fantastic. Okay.
Yes. There are a few states, I think Connecticut, Minnesota, Wisconsin, and there's one more. But they have their own little unique type Medicare supplement plans in each of their states. All of the other states, Medicare supplement plans are identical. So a Plan G in Nebraska is going to be and provide the same coverage in California. Okay.
Great to know. That takes maybe one more thing off the to-do list for a caregiver.
Yep. That's so true. So that was, what came out, Medicare supplement plans was what came out to help pay for those out-of-pocket costs. And as you had mentioned, Medicare Advantage plans, I'll get to that in just a moment. But the other key point of Medicare that came out in the early 2000s was the drug plans. And back in the day, years ago, Medicare supplement plans used to provide drug coverage within their plans. And then they realized there was a change within CMS and Medicare that they took out the drug coverage component within Medicare supplement plans, and then they created standalone drug plans.
So you would have a Medicare supplement plan, and then you also get a drug plan separate from that.
Right. Yep.
Okay.
Yep. So, there's kind of two different routes that you want to go. And I'll kind of touch on this really quick. There are major changes that are coming with the drug plans. And so that's why each individual really needs to look at what their current coverage looks like for their drug plan now, and then what it'll look like for next year. So everyone has to review. So really the drug plan is another segment of the Medicare, and it does help provide costs and lower the costs of the drug expenses for seniors. The plans are in formularies, or the drugs are. So we plug in their information, what medications they're taking, and we'll see how it falls within each carrier and how the formularies look and what their out-of-pocket expenses are outside of a monthly premium. So,
So, and we know many older adults are taking a variety of medications. So sounds to me like the benefit of working with an agent that is familiar in these types of insurance products, these Medicare products and these drug plans is so helpful because they will plug your unique information in and help you figure out, okay, what drug plan based on the drugs I'm taking, medications I'm taking, is going to be the best for me and my financial and health situation.
Yes, that is correct. Yeah. And it is required for an individual to have a drug plan at the time in which they get Part A and Part B of Medicare.
Okay, that's great to know.
If they don't, then they will have a penalty. So there would be a percentage increase on their monthly premium that will forever be embedded into their plan. So
Okay.
they want to try to avoid that penalty. So, individuals may say, well, I'm not on any medications. And that is wonderful. That is great news. However, you still need to have a drug plan. So we can go with a
Oh,
very
okay.
basic plan. And then each year I review that plan and see, has your health changed? Has your medications changed? Has the plan that you're on changed? What does it look like for next year? And best case scenario, we take a quick review and we realize nothing needs to change. You can stay with the same carrier and the same plan that you're on. So, however, next year we're seeing a lot of changes with the plans.
So that would be not for this open enrollment period, which we're now in, but it would be in the 2025 open enrollment period where we're going to see a lot of those changes. Is that what you're saying?
Yeah. So actually right now here in this AEP, is for individuals applying for drug coverage that's effective January 1st of 25. So
okay. And just real quick, what's that acronym mean? EAP.
Oh, AEP is the annual enrollment period for
Okay.
For Medicare drug plans as well as Medicare Advantage plans.
Okay. And that's also known as open enrollment, right? Is that right? Kind of?
Yes,
they coincide?
It can't be.
There's so many terms that are thrown out there, and that's where I can get so confusing. So thank you Kristen, for breaking this all down for us.
Yes, you're welcome. So it's definitely important to know the plans are changing next year. Oh, I want to point out something else too. With the drug plans, it is based off of your income, just like the Part B of Medicare.
Okay.
Your income will determine then how much your monthly premium is for drug coverage as well.
Okay. And does it still have that 2-year look back, just like, okay, we talked about earlier?
Yes.
Okay, yep. Great to know.
2-year look back. So with the drug coverage that is intact today it's going to be a little bit more costly for individuals. It's currently on for 2024 is that, there is a deductible that an individual has to pay. And then they themselves, as well as their plan, they pay up to $5,000 for that drug costs. And then they go into the donut hole, the notorious donut hole, and otherwise known as the coverage gap, where the patient then pays 25% of the total drug costs. So they're paying out a little bit more during that donut hole time period. Once their total costs get to to $8,000, then they're in the catastrophic phase, meaning that if they've maxed in that calendar year $8,000 in their total out-of-pocket costs, then they no longer have to pay for their drugs. They are essentially, all those expenses are free at that point.
Okay.
Now you have to meet that in a calendar year because it starts over each year. So it can be tricky. A lot of individuals don't quite get to that catastrophic phase. So, and CMS and, Medicare, they saw that with individuals and they realized that seniors are paying a lot for their drugs. And within the Inflation Reduction Act that came out a few years back, they said, let's try and lower the out-of-pocket expenses for seniors. So what they're implementing for plans in 2025 is that an individual, they'll have their deductible still, but their total out-of-pocket costs will be $2,000 for the whole, for the whole year.
That's great. Wow. We just got to kind of hold out for one more year in this drug coverage conversation. And then it sounds like it's going to get a lot more affordable because unfortunately we hear older adults sometimes have to make choices between paying for medications and other necessities. Because to your point, some people fall into that kind of donut hole where they've paid up to that amount and are just really burdened with the price of their medications. So it's good to know that they're making strides in that arena, but it's not going to be till 2025.
Well, it will be. Yeah. So
fantastic. Okay. So I'm getting all my calendar years mixed up.
You're fine.
Okay.
So they really need to sit down and review with their agent. If they don't have one, I'm happy to help and review what their drug coverage is now for next year.
For next year. Okay.
And also what they also implemented, which is a nice feature, is that it's a payment plan, which is really kind of unheard of. So if you are on a lot of medications and you see that you're going to max out, you're going to spend that $2,000 pretty quickly at the very beginning of 2025, and you can't afford all of that out-of-pocket expense, then you can make payment plans to your provider, whichever carrier you have for your drug coverage, and then you can make those payments each month. So every time you go then to the pharmacy, you don't pay anything. You just pick up fill your prescription, you pick that up, but then you continue to pay a premium in your payment for your drug costs over the course of the 12 months. So that's a new feature as well.
A new feature for 2025, just this next year. Okay.
Yes. Yep.
That is helpful to know.
Right. Yeah. So some big changes going on. The drugs are going to be going into different formularies for where they're currently at. So that's changing as well. And we're hearing that the premiums for the drug plans may be going up in price, but CMS, they are going to be subsidizing for those differential, kind of what the drug plan's monthly premium was or usually is and what it's going to, and they're going to help subsidize that difference in the premium.
Okay, so that will take place in 2025, kind of a subsidy for making the kind of monthly premiums a little more affordable, kind of helping with that difference that you might be seeing. So you might think, oh gosh, wow, my premium's really going up next year. But looking into that subsidy from CMS, that's what families need to maybe have a little peace of mind knowing that there's going to be some additional support in that way.
Right. Yes. So, more information is still coming in and all of that and the subsidies. So, but at least the government is going to help pay for that differential for sure.
That's great.
Yes. So, and then as you had mentioned earlier, the Medicare Advantage plans. So that is really, Medicare Advantage plans came out in the, early 2000s. They are an alternative to original Medicare. You still have to have Medicare Part A and Part B. You need to be enrolled in both Medicare Part A and Part B. But it's going to provide some additional benefits. So a lot of the plans have drug coverage built into them, or they have dental, vision, and hearing benefits, as well as wellness programs, over-the-counter benefits. So if you go to the store and you pick up, Tylenol, any of those over-the-counter type of medications, then it will help pay for those expenses too. So, each carrier kind of offers different unique programs, but Medicare Advantage plans are provided through private insurance companies, and it's not through Medicare, but they have to be all approved by Medicare.
Okay.
So
that is kind of the alternative to the supplement plans.
Right.
It would be this Medicare Advantage plan. And I feel like you see tend to see commercials for these plans on TV quite often.
And especially right now.
Yes, especially right now. Yes, absolutely.
Yeah.
So what are some of the key things people need to know about the Medicare Advantage plans? So
Medicare Advantage plans, they're all either be a low premium or zero premium. And you think, how can that be? It's really just kind of how you want to pay for your healthcare. So you can, and I want to flip to this one other slide because there's a couple other slides I just want to show to point out, even though you may look at a Medicare Advantage plan and you see that there is no premium, it's a zero premium or it's a very low premium. There are going to be out-of-pocket costs if you go to the doctor, if you go into the hospital, if you have a procedure done. There will be some expenses with that. Okay. So when you look at a Medicare Advantage plan, you want to make sure that your doctors are in the network or that you have a plan that gives you the flexibility to see out-of-network doctors as well. Okay. So
that is important because especially a lot of people have been seeing the same physician or doctor or healthcare provider for extended period of time. And so making sure that the provider is within the network is, for some people, is going to be an important factor.
Mm-hmm. Yes, for sure. So I like to go with Medicare Advantage plans that have coverage for in and out of network doctors. As life goes on, you may run in and you realize you may have a health condition that needs to be addressed at maybe the Mayo Clinic, in Rochester or in Phoenix. You want to make sure that your plan will provide some coverage if you go to a facility or a doctor that's out of network. So I always try to have as much flexibility with those plans as possible so that they don't run into any issues.
Those are really great things to consider.
Mm-hmm.
And also just to know that, for some people, the zero premium or low premium plans might be, good for them from a financial perspective, but to also just set aside in your budget, perhaps, for some of those other healthcare costs that you might incur. So just really understanding what is and is not covered by the Medicare Advantage plan, I would imagine is really important just for planning purposes and to make sure that all of your healthcare needs will be met.
Yes, exactly. So where Medicare supplement plans that we spoke about earlier, their average, they do have a monthly premium, and it could be just, let's say on average, about $1,500 a year for a Medicare supplement premium, for your annual premium for a Medicare supplement plan. However, if you go into the doctor, you have a procedure done, pretty much everything's covered. Mm-hmm. You don't have a lot of out-of-pocket expenses. And then you'd have your drug plan, and you'd have that premium tied with your drug plan, and then any co-pays that you'd have to pay to fill your prescriptions. So then Medicare Advantage, it's kind of the opposite, lower premium, if premium at all, on a monthly sum. But yet, if you do have a health condition, you do need to go into the doctor, you do need a procedure done, then you need to pay out the money. So,
okay.
Do you want to just pay it all consistently each month and know that you're covered? Or do you want to, I'm healthy, I'm good, I don't need to pay a monthly premium, and I'll only pay when I need to be seen, kind of mentality.
Yeah, it kind of makes me think of like when you're working, you might have a high deductible health plan where you pay higher premiums or copays or whatnot, or you have another option. And so it's good to know your options because not everyone is a one size fits all situation. And so I think that it's helpful to hear, how these are different and how families can be thinking about them and planning for them.
Yes, exactly. And so it's just each person, how they handle their money and their finances is different. And so you always want to lay out the options to them and explain the differences between the two and how do they want to, handle their healthcare. So this is a great slide. I do love this because it kind of just wraps everything up. It's showing you can go on the left-hand side. It talks about picking up the Part A and Part B of Medicare, and then have a Medicare supplement plan, and then have a drug plan. Or you can have a Medicare Advantage plan that, and a lot of times include that drug coverage as well. So it's all in one.
This is a great slide. It's called "What Coverage is Best for You." So if you're listening, I would check out the video version of this episode and go right to this slide because I think it's very, very helpful and helps explain really the two options and can help you understand what all goes in to both options. So great slide, Kristen.
Exactly. And, outside of Medicare and working with clients for, getting them set up on original Medicare and then what other type of coverage they're looking for. We also work with clients for hospital indemnity, and hospital indemnity plans work great when you have a Medicare Advantage client. So that they helped cover those out-of-pocket expenses if you happen to be hospitalized. So as well as other conditions. So, and there may be a small premium with that hospital indemnity. And if you have a Medicare Advantage with a zero premium or very low premium, and then you have, or you have a Medicare Advantage with low premium, and then you have a hospital indemnity with a lower premium as well. It would just pay out if you happen to go into the hospital, and it's just an indemnity. So it's directly paying cash to you, so then you can pay the bills off on your end.
Okay. So yeah, these solutions, again, are so unique to the person. And so I think that is another great point about, working with an agent that you trust and that is reputable to help you walk through all of these options. So hopefully this has been like a good kind of overview of it all, but I think making that local connection can be really, really helpful.
Yes, definitely. So hopefully it wasn't too much information.
No, I think, we're all learning on this journey. And I think really we just want to equip family members and older adults with as much information as possible to just help navigate all these complexities. And hopefully we've accomplished that today. And Kristen, I know that, the work that you do through Meaningful Insurance Solutions, people can also connect with you on your website if they have more specific questions. I just appreciate you going over this. Is there anything else we haven't covered that you think is important for folks to know?
I guess I would just stress the importance of having your coverage reviewed now during this annual enrollment period, because January will come quick, and then you are really locked into that plan until next fall, till the fall of 2025, and where you can review, your plans for 26. So just want to make sure that they are set and they have the right plan in place for next year, as there's some drastic changes. So I would be happy to talk with anyone.
Fantastic. Well, Kristen, thank you again so much. We'll be sure to connect or put your website in the show notes so people can connect with you to learn even more. And I just, again, thank you so much for breaking down such a complicated topic into something that we now have a better understanding of. So thanks so much.
Yeah, thank you. Thanks for the opportunity. It was good to talk with you here today.